And now, we bring you the following live press announcement from D.C. Mayor Muriel Bowser. Our regularly scheduled program will resume following the announcement.
Bowser. I'm the mayor of Washington, D.C. I'm joined today by members of my cabinet to provide an update on several issues affecting the District of Columbia. I'm joined by Dr. Nesbitt, who is the leader of the D.C. Department of Health, Chris Rodriguez, who is the director of the D.C. Homeland Security, Chris Gelthardt, who is the leader of D.C. DPW and is leading our operations group at the Emergency Operations Center, as well as Jay Melder, who is the Assistant City Administrator. With several holidays upcoming, we're going to spend some time going over the DC Health guidance, provide a COVID update, and take your questions. Before we get into that, I want to remind DC residents that early voting begins tomorrow in-person early voting, I should say, begins tomorrow in the district. Of course, many Washingtonians have already returned their ballots by mail or one of our drop boxes, and I want to remind everybody that you can continue to do that as well. But starting tomorrow, you can go in person to our early vote center to vote in the 2020 general election, and the voting hours are 8:30 a.m. to 7 p.m. And so you can go to the DC Board of Elections website to find out where all of those locations are. And no matter where you live, you may vote at any of the early vote centers. If you're not registered to vote, remember that in DC, same-day voter registration is also permitted. So you can register same day at any of the early voting centers. You just need a valid proof of residence. So again, please go to the DC Board of Elections website to find out about all of the locations. And this year, the Board of Elections is also utilizing what they call super vote centers that can accommodate larger numbers of voters. So also look on the website for those locations. The early vote centers may not be the precinct that you are used to going to. So just make sure you check, make a plan to vote, and go vote. In-person early voting begins tomorrow. And again, you can go to dcboe.org. Those vote centers are also available for Election Day, which is next Tuesday, November 3rd. So we'll be able to answer limited questions about that and refer other questions to the Board of Elections. Now, let me say a few things about COVID. This morning, we reported 45 new cases in our community. Unfortunately, we do not report additional lives lost. We are also showing, as we do every day, the numbers in the categories of metrics that we follow to show how district residents and businesses are helping to curtail the spread of the virus. We've added a new metric in the community engagement category, the fourth row, and that refers to the app that we started last week, and it indicates the number of people who are opting in to the DC CAN or the exposure notification app that is on your mobile phones. And Dr. Nesbitt will have a little bit more to say about that as well. Now let me turn to our holiday guidance because we're coming up on some of our most fun times, I know, that we celebrate together as families and friends. And we just want everybody to start to plan and make sure that what should be a fun holiday gathering doesn't turn into a tragedy for your family. So please be very mindful about how to keep safe during this holiday season. Let's remember that as we go into the 8th month of living with this pandemic, that we've all made sacrifices. And we know that it has been more than worth it. We see and we look into the news each and every day about cases going up across the country. And we want to be able to continue to stop the spread as much as we can in the district. We have already lost 642 Washingtonians, and that's 642 too many. So please, please pay attention to guidance, use your common sense, and also know that this virus will pass and there will be other very special holidays for us to share together. At the end of this week is Halloween, so let's go over some of the basic guidance that we have already discussed when it comes to celebrating, when it comes to family celebrations. So starting with, always consider your most vulnerable family members when making plans. And if you choose to host an in-person holiday gathering, keep the group as small as possible, and remember to practice social distancing and ensure that everyone wears a mask. Even your related family members, don't let your guard down. It's very important that everyone wear a mask who's outside of your immediate household. Keep in mind that while outdoor activities are safer than indoor activities, the virus can still spread outdoors. And also one of the big ones is, while we know a lot of people travel during this holiday, we really recommend that you avoid that and keep your celebrations in the National Capital Region. Further, if you do host a small gathering, here are some very critical do's and don'ts. When deciding how many people to invite, consider the amount of space you have and the ability to distance during the event. And that's, of course, relative. So don't just say, well, the DC guidelines say I can have 50 people if you have a postage stamp living room or backyard. So keep in mind the amount of space you have for appropriate social distancing. Also, remind your guests to wear a mask and stay home if they feel sick. And you should also know that if you feel sick or a member of your household feels sick, you have to cancel the event. Clean and disinfect commonly touched surfaces and shared items between use. So just remember that these are some very important reminders that if you are going to do a small gathering that you should follow. And for Halloween specifically, here are some high-risk activities that we are asking you not to participate in this year. Traditional door-to-door trick-or-treating. Trunk-or-treating, where children take candy from trunks of cars and large parking lots. Please avoid that. Taking candy from communal candy bowls. Please avoid that. Going on hay rides with people that that are not from your household. Going to indoor haunted houses, and no bobbing for apples. But there are some medium risk events. The previous list we consider high risk. Here are some examples of medium risk. One-way trick-or-treating to pick up individually wrapped bags. Small group outdoor costume parade and contest with social distancing. Open air, one-way walk-through events. Pumpkin patches or orchards with social distancing. A small group for a Halloween outdoor movie, and other events that are held outdoors. The safest way also note that I didn't say it was no risk, but the safest way to celebrate per DC Health is to decorate your house and your yard for Halloween and invite neighbors for a drive-through event. Carve pumpkins with your household and display the pumpkins outdoors. Have a trick-or-treat candy hunt with members of your own household, or have an online costume party, contest, pumpkin carving, and video chat. So this year, our young people have shown that they are resilient, and I'm so proud of them. I know that they are excited about Halloween, and they will also be excited about developing some new traditions during this COVID period. So I look forward to seeing all of the wonderful pictures and social media posts about our little ghosts and goblins. In a month from now, we need to also celebrate. And we're looking forward to celebrating Thanksgiving, because even in a tough time like we're in, I know I feel very thankful for all that I have. And so we want to share advice today about and have you start thinking about how you're going to celebrate Halloween. Again, we discourage traveling outside of the National Capital Region. And we also discourage attending or hosting large indoor gatherings with people from outside your household, including close friends and family. We discourage attending sporting events or parades and in-person shopping with crowds. Here are some examples of medium risk activities. Having a small group outdoor dinner with family and friends who live in the National Capital Region while using everyday prevention measures, including wearing a face mask and social distancing. We also encourage, or we advise, a more medium risk activity would be going to a local pumpkin patch, picking apples at a local orchard while social distancing. And here are other low-risk activities. Having a small Thanksgiving dinner with only your household members, hosting a virtual dinner with extended friends and family using video technology. Watching sporting events, parades, and holiday programs at home with your household, and shopping around Thanksgiving, so-called Black Friday or Cyber Monday deals online, and preferably finding local retailers that you can do that shopping with. And so let me end by saying this. It may feel unusual wearing masks around your guests. You know, I had this experience yesterday at my own home when my brother came to visit me for several hours, and he never took off his mask. And then I realized that I need to put on my mask too. And so while it may feel awkward and uncomfortable, we know that that's the best way that we can take care of each other. We will remember that this pandemic will get on the other side of it, and we'll be able to have fantastic events in years to come. So please go to coronavirus.dc.gov/phase 2. And I want to thank the DC Department of Health for their creativity and putting all of these recommendations in one place. And I know we have super creative people out there, and you will think of even different activities that fall into those risk categories to keep your family and friends safe during this season. So with that, I think that is our update, and we have time for questions. Yes, ma'am.
Muriel Bowser, Trump campaign sent out an email recently saying that they are interested or intending to have some kind of election night party at the Trump Hotel. I know previously you've been unable to do anything legally speaking, things that Trump has done since it's been on federal land, but the Trump Hotel is, of course, on DC land. So have you heard about this? Have you been in communication with the campaign? And if they do try to have an event of larger than 50 people, what kind of measures will the city take?
I heard about something this morning, and we will be in touch with our licensee, which is the hotel. Yes.
Dr. Nesbitt, In reference to early voting starting tomorrow, what advice do you give residents who choose to go to a voting center as opposed to mailing in their ballot, which is what the Board of Elections kind of advised to do? What would you advise residents to do if they go to a voting center during this pandemic?
So we have a guidance document on coronavirus.dc.gov that we would encourage people to review. But our focus has really been on encouraging people to do some of the same things that we recommend all the time. You know, voting is extremely important as part of all of our civic responsibility and duty when we become of age to vote. So we want people to be as engaged in that process as possible. And there are a number of ways that people can be engaged in that process. For people who choose to exercise that right in person, we want to make sure that they do not go to a voting center if they are sick. Because we want to make sure that we keep the risk for the spread of the virus down, and that we protect all of those people who are doing their civic duty by being poll workers. So that's an important thing for us to remember as well. We want people to know that they should be wearing a mask when they go, and that they should have a plan. We know that BOEE has done a tremendous amount of work to ensure that the process can be efficient, but that if people are going to go to vote, that they should be prepared to have that mask on the entire time, that they should have a plan for waiting because so many people are interested in exercising their right to vote, and that they should be prepared to practice all of those good community hygiene practices while they are there. But social distancing is going to be a key part of the voting process, so people are going to need to be prepared to be mindful of how they're keeping 6 feet apart, of how they're going to be practicing good community hygiene. So having that hand sanitizer on hand if they need to touch their face or grab a snack while they're waiting, all of those things are going to be critically important. So we want people to be as prepared as possible. But if you are not feeling well, you have received a ballot in the mail, so you still have the opportunity to put that in the drop box in lieu of actually physically going into that early voting center.
So just another reminder that we have the early vote centers listed there. Jay, how many of them are they?
32 early vote centers.
So there are 32 early vote centers that will be open from tomorrow through Election Day. And on Election Day, additional vote centers will open, correct?
That's right. There'll be 96 total vote centers on Election Day.
Yes.
To follow up on that, this morning Maryland opened their early voting with some long lines. People were in line at 5 a.m. Are you expecting lines tomorrow? What should people plan on if they go?
I don't know if there will be long lines, but I will say to everybody, take advantage of all of the 6 days of early voting. There is going to start tomorrow, and I think history demonstrates that some of the most early voting happens on the first day. I think I got that right. So plan, you have a whole week, but don't wait till the last day. There will be many people who vote on Election Day, but you can vote early in person. You can drop off your ballot right now in the mail. You can drop off your ballot right now in a secure drop box, and many thousands of DC residents have done that. So just don't wait until the last minute. Yes.
Can I follow up on that, Mayor Bowser?
Yes.
I believe you waited until Election Day on the primary day to vote. What are your plans for voting when do you plan to vote this time?
I will vote this week, probably on Wednesday.
Person.
I will.
And then could I follow up just about security and what the district's plans are? We've seen a lot of internet chatter about protests being planned from both sides, preparing for the possibility of whether the results will be accepted by the president and whether there might be voting irregularities. We've seen civil unrest already in the past months in DC. What are your plans between DC Police and the National Guard and whatever you have at your disposal to keep everybody safe in election night and the days following?
Well, Mark, let me just say, we have been working on how to keep the district safe for many weeks, if not months. It's not lost on us that we have been a magnet for a lot of national attention and some negative attention, and people who are drawn here because the major actors are here, and there have been some events here that have been unusual. So we will continue to work, of course, with our police department to make sure we have the resources we need around likely areas, but also that we have the resources that we need in our neighborhoods. And we will coordinate with our partners. So our Department of Homeland Security will help in how we have our emergency operations set up for that night. There's nothing really more specific I can say.
Do you know what the posture of the National Guard will be leading into that week? As you know, we have the Guard called up now, and if we need them, we will use them. Typically, they have helped us with traffic control. Yes, Sam.
Yes, Mayor, just curious, Initiative 81, I guess, to deal with mushrooms. I don't know, have you decided how you feel about that?
It seems like that is not a DC or organically DC created initiative, and I don't typically favor those.
Opposed to 81?
I won't be voting for it.
You'll be voting against it?
Mm-hmm. Yes.
Dr. Nesbitt, can I ask you about the new contact tracing iPhone and Android app? How many people do we need to sign up to have it be effective? How many people have signed up so far? And a question from a reader, do you need to have your Bluetooth turned on for it to work?
Yes, you need to have your Bluetooth turned on for it to work. It works through Bluetooth technology. We have a FAQ on our website. There's other additional blogs that you can follow through Apple and Google that will give you more information. We have not set a specific number that people of the district population that need to sign up for it because various percentages of the population use Google or Android-enabled phones, as well as Apple phones that run on the iOS platform, which are the only phones that the technology supports. We do know that we need a good proportion of the population who have those devices to opt into the technology in order for the technology to work, because it sends signals through those devices. I will remind people that this is an additional tool in our toolkit to support contact tracing activity. It does not replace the contact tracing that we do through telephonic interviews, through the virtual assistant tool, COVID Link, that we introduced a few weeks ago, as well as the home visiting program that we've discussed here before.
How many people have activated it so far?
So we have a metric that we've been presenting. We've been in discussions with Google and Apple, who are providing us data. Right now, we are preliminarily reporting about 190,000, but we're refining that number based as we get more details around people who are actually consenting and opting in. We'll have that number refined probably by midweek this week, and then it will appear consistently on the dashboard thereafter. But our early estimates are well over 150,000 people. So we'll get it refined by this week, middle of this week.
Thank you.
So the number currently on the dashboard, is that an estimate?
It's a preliminary estimate, yes.
Okay, all right. And then I know that you don't have an exact number set, but about what proportion of the population would you need for it to be an effective addition to your contact tracing abilities?
So I'll repeat what I just said. So various people, so for example, I have both an Android and an iPhone, as I have one for work and I have one for personal use, right? So it's difficult to say exactly how many of those devices exist in our market. But we do have, based on how like some jurisdictions have created their own app, we do have some of the most aggressive early adoption of the technology of any market so far, based on our conversations with Apple and Google. Having 5% of your overall population would not be successful. Like, we have 700,000 people here, so we have been very forward. Have had great early adoption by their technology standards, but there is no specific percentage of our population so far. I hope that's helpful for you all.
Right.
Dr. Nesbitt, I know you've been monitoring over the months the vaccine people or companies who are working on the vaccine, and there are a number of them. I'm just curious, does the district government have, or considering when the vaccine comes out, or vaccines come out, several may come out at the same time, a relationship in terms of contracting relationship with one of them, maybe AstraZeneca or Pfizer or Johnson & Johnson?
Okay, so thank you, James. I appreciate the spirit of the question. We have shared a longstanding approach, or had a longstanding approach in the District of Columbia, where we accept the recommendations of ACIP, the Advisory Committee on Immunization Practices, which is a committee of individuals appointed by the federal government that advises the director of the CDC on which vaccines should be adopted for use in the United States. The ACIP has been reviewing data for the vaccines that are in development for COVID-19, or to combat the virus SARS-CoV-2, which causes the disease COVID-19. We have a scientific advisory committee in the District of Columbia that is comprised of 15 individuals, some clinicians, researchers, pharmacists, as well as members of our community. It's about 2/3 clinicians, scientists, researchers, and 1/3 community members who are following the deliberations of the ACIP, as well as the National Academy of Medicine, which is creating a framework for prioritization and equity. So they are also looking at issues of safety and efficacy to make sure that we are not missing anything in the vaccine development process. So between those two approaches, looking at how the ACIP process, which is a well-established, very reputable process, independent, having our own scientific advisory committee, which is also following the deliberations of ACIP, any FDA convenings, any other public meetings where data is made available, we will be able to follow how these vaccines are moving forward for FDA approval, whether it be licensure or emergency use authorization. State and local authorities will not have to contract individually with those companies to access vaccine. Vaccine will be made available to states without charge through the Operation Warp Speed process. And that's how our conversations, and my conversations directly with General Perna and individuals with the CDC, have progressed to date.
Regarding vaccines, both Maryland and Virginia have publicly released their vaccine distribution plans. Is the district going to publicly release its plan? If so, when can residents expect to see that? And if not, why is that the case?
I think we've talked about before, Dr. Mesma, if I might, that the plans are in draft, and we're going to be sharing the plans when we know that they're final. Yes.
Yeah, Mayor, I know that, obviously if there were some major education announcement, the chancellor would be here, but I just have a couple of questions. I understand that some of the numbers that you all released last week are not as bad as you originally had thought. And also, how is the partial reopening proceeding that's set for November 9th?
You are right. My staff told me that, and I don't have it in front of me, Sam, but we will be updating it. We reported 2 numbers of lost progress at 11% and 22%. Don't ask me the categories right now, but one of those numbers, instead of saying 22%, it should have said 11%. So we will be updating that and getting it back to you. And
Proceeding as far as you're concerned. We had on Friday, we were reporting about the council hearing, chancellor before the council being asked a lot of tough questions, a protest out in front of the Wilson building. Any thought to, let's say, not starting on that date, or any change, anything?
well, I can tell you, since last we spoke, we were proceeding along our schedule and continuing to have all of our buildings updated, updating our websites with building-specific information about the building checklist, as well as HVAC upgrades, and the operations plan for each one of our elementary schools. So all of that is proceeding. Families this weekend, as I mentioned on Friday or Thursday, but I think it was Thursday, have also received emails offering them a slot for in-person learning according to the priority list that the chancellor reviewed with you. I think at the end of this week, we will also be emailing parents for opportunities to participate in the care classrooms, where their student will participate with their classmates in in-person virtual learning. And so those email offers, I believe, go out at the end of this week. So we are proceeding according to schedule. The chancellor would have a better update, but we continue to be at the table with all of our union partners as well. Yes.
It seems very likely that there's going to be yet another large outdoor event at the White House this evening for Amy Coney Barrett. Again, I know that there's nothing you all can do about that legally, but what does it feel like to be, almost having this deja vu of watching this event happen again? And what communication have you had with the White House about this potential event this evening?
I mean, I would throw that question out to DC residents and voters. What does it feel like to see people flaunt scientific evidence and common sense? The last time you were here and you did this, X happened. So that's a question for voters, quite frankly. What does it feel like? But it's also a question for people who have been invited. You've heard me say this before. Just because you're invited someplace, it doesn't mean you have to go. And I know that there were a number of people who attended that Rose Garden event who became sick, who were quite embarrassed by their participation, who had to go back to their constituencies and communities and explain their behavior. And so we don't want any folks, our residents, certainly from DC or in our surrounding region, to be in that situation. It's the problem with, and let me just say a bit more about, how I think reasonable people consider these things. When I go someplace, part of my calculus is, how will I get out of there if I see things that aren't safe? How will I leave? And if I cannot assure that I can leave easily, I won't go. And that's for going to someone's house, that's for going to a restaurant, that's for going, I wouldn't go to a large event like that. But that is the question you have to ask yourself. If you get someplace and it's not safe, you don't feel comfortable, for all you know, you could be packed in a Rose Garden event with somebody sitting next to you hacking. Ask yourself, if that's happening, are you going to get up and leave in the middle of the president's remarks? If you're not, you shouldn't go. So those are the types of very commonsensical questions that people have to ask themselves. And the thing that we have learned, and Dr. Nesbitt has really drilled this in my thinking, is you don't know who's going to get very sick from COVID. You don't know that. 642 people have died here. So you can believe that you can go to the White House and get COVID and nothing's going to happen to you, perhaps, or you could die from it. So that's just the kind of decision that I make. I want to live, so I'm going to try to make as best decisions that are smart. Yes, a few more questions.
Can I circle back to the holidays? And
Yes.
just, you talked about Halloween, Thanksgiving, and Black Friday. And I'm just wondering, either between you or Dr. Nesbitt, of those three, what do you guys see really as causing you the most concern as far as an event that may turn, in your words, may turn tragic for a family?
Well, I think that it should be clear from my remarks throughout this pandemic that small gatherings concern me, because I think specifically people are they let their guards down because they're in a familiar setting, their home, family members' home. They're with familiar people, their own family, and there's celebration. So there's a lot of food and drink, and that also causes people to let their guards down. So I personally am concerned about that. And we know that there's kind of a lot of moving around related to that. So people are exposed to other people, and not necessarily from our area. All right. Yes, sir.
Mayor, kind of a controversial thing in the council. I'm just curious about your view of 11-year-olds and older being able to get vaccinations without parental consent. What's your thought on that?
To be honest with you, Sam, I didn't know that was an issue at the council, and I would need to know a little bit more about it before I commented. Thank you.